The most stressed out part of your day is not when you at work. It's not when you're, working out, jogging or whatever you're doing. The most stressed out part of your day is actually around 4 a.m., 5 a.m. when you're asleep. But your body already senses that you're about to wake up. The sun is about to come out. So if your body is naturally on the circadian rhythm, then the most stressed out part of your day is when your blood starts to rise again, because as you sleep, your body's at a parasympathetic stage. It has a rest and digestion stage. At a deep sleep, or from a light sleep to a deep sleep, and all of a sudden, that temperature rises, that your blood sugar rises, and your blood pressure rises. This is the most stressed out part of your day. So you're jumping from maybe 40 beats per minute all the way to about 80 beats per minute. You don't even do that when you're working out. So I just want to throw that keynote in about adrenals, because people that are actually having sleep problems or wake up in the middle of the night at 2 a.m. and you're wide awake, and then you fall back asleep, and then you wake up tired again. That is adrenal fatigue. That is a big, big symptom. If you're noticing that's happening and you can't really fall asleep at night, but by the time you do fall asleep, it's about time for you to wake up, to go to work, and that's a symptom of adrenal fatigue also. So we are stressed out, everyone. We are stressed out about even thinking about the next day of going to work. Or certain thoughts are flowing through our heads when it comes to finances, when it comes to our relationship, when it comes to children, working. It's a lot going on when it comes to our mental tolerances. And it affects our adrenals. Our adrenals are what handles our stress hormones. And also, being that you can't sleep, I had to throw this in because if you can't sleep and you're suffering from adrenal fatigue, then you're going to have what the medical word is pernicious abdomen. Now, we know what abdomen is, basically the visceral fat of the stomach. But the pernicious part is a saggy stomach or a saggy belly. You get this saggy belly because in the middle of the night, digestion and rest is supposed to happen. Insomnia sets in and you can't even burn fat. So that fat starts to store right down your abdomen. And that's why people develop something called Cushing syndrome. Cushing syndrome. Everybody research Cushing syndrome. Cushing syndrome is basically your buffalo shoulders. When somebody got a wide back or a buffalo shoulder right here, it's just bulky right here. A saggy arm. Your arms are saggy. You got too much fat on your arms. Or the pernicious abdomen, the saggy stomach. Usually that person is having adrenal problems. And they need to support how they handle stress and how they sleep. Sleep is very, very important. So there are plenty of adaptogen herbs. Those are herbs that handle how well you tolerate stresses. These herbs are like ashwagandha, astragalus, eleuthero, rhynemia. You got rhodelia. I could give a whole formula list of all adaptogenic herbs. But these herbs, have to be taken. Well, my formula, adrenal support formula, needs to be taken about 3 times per day. You can switch them up however you want to do it, but it definitely needs to be consumed at 3 times per day. Especially for those who are maybe going through dialysis. Dialysis, you got a lot of stress going on with the renal arteries, and that's near the kidneys. So that would help support the heart from the high blood pressure, and it would also help support the kidneys from being so stressed, all the waste and toxins that are being filtered through the nephrons. It affects the whole entire endocrine system. As far as the system that is having a lot of stress on it, especially with the women, you know, your ovaries have a lot of stress on it. Every month you're having to have an menstruation, and the pituitary gland is also releasing a hormone that has to be controlled exactly by the pituitary gland and the adrenal. And when it's released from the adrenal, it has to go directly to the ovary. This is called follicle stimulating hormone. And sometimes this hormone does not produce enough progesterone. That is a female hormone that's basically getting you ready for gestation. So, for gestation, so getting you ready for pregnancy. Some people don't secrete enough FSH. So, when you don't produce enough FSH, you can't get pregnant. So that's another way you get stressed. The testes for males are producing what you call testosterone or androgen. These are male hormones. Some males are sterile and can't produce enough testosterone, that hormone that's being able to allow semen to flow. The endocrine system has a lot to do with the thyroid gland. Thyroid gland secretes thyroxine, or what we call TS8, TS3, TS4. This hormone, it has to be regulated by the pituitary gland, by the hypothalamus. It works on a negative feedback loop, and just take a little time to talk about negative feedback loop. Even though I'm throwing a lot of medical information, of course, think about how your toilet flush. Your toilet has to, when you flush the toilet, the water goes down. As it goes down, and the inside of the tank has a filler valve, so it has to raise at a certain level so it knows exactly where to stop at, and then the water rises back to the regular level. You can flush it again, and then it does the same thing. It goes down, and then the filler valve allows it to raise back up. Now, there's a certain level of thyroxine that your thyroid has to have. There's a certain level of calcitonin that your parathyroid gland has to have. And these have to do a lot with iodine supplements and selenium supplements. When you are supplementing with these, which we don't have in our everyday supply, the endocrine system starts to deteriorate. You're either going to have hypothyroidism or hyperthyroidism. And a lot of stress is wearing down on our adrenals, because in this system of endocrine system, what happens is your heart rate either goes down for hypothyroidism or it goes up for hyperthyroidism. And with that amount of cortisol that is being secreted from the adrenal, which is basically epinephrine, that's the medical terminology. When this is not being supplied enough, then they have to give you which meaning your blood supply is not being able to flow enough. It's not receiving this hormone to either turn off or turn on. That's the same thing with happening with the toilet. If that filler valve does not raise up, then it just continues to flow and it overflows that toilet. You get what I'm saying? So hyperthyroidism is basically an overflow of thyroxine. The pituitary gland is secreting the thyroxine, but it doesn't know when to turn off. And all hormones, the keynote, all hormones are turned off by the liver. That is one of the main functions of the liver. Things have to be turned off. You cannot go or leave your tub on and expect it not to overflow. So, all in all, about this adrenal stress and adrenal fatigue, in order to repair it, you got to eat, so that you don't have low blood sugar. A lot of times you spike your blood sugar and your cortisol levels are raised and your adrenaline starts to rushing and you start to develop cravings for sugar. People that drink those energy drinks or caffeine, the coffee, you got to cut all those things out. Those are the things you have to avoid. So I remember having a customer call me and say, I'm having headaches. I took the adrenal formula and I'm having headaches. You know why you just had a headache? You drunk some coffee. Because that's producing actually cortisol and adrenal at the same way as that fight or flight type of reaction. So now it's kind of hard to focus, or you having palpitations. You can't do that anymore. You're actually trying to repair your adrenal fatigue. So the right things to eat is high in antioxidants, high in carotenoids. That is your bright yellow, orange, red fruits and vegetables. You get your mangoes. You want to avoid the high potassium. That's your raisins, your bananas, your dates, prunes, things like that. But you definitely want to have a normal intake at regular intervals of food. Your high in fruits and vegetables. That's how you repair your adrenals. You get your sleep back that way. So, just want to let you know, guys. I appreciate your time for learning how to repair your adrenals. You visit ShalomHealthServices.com. Check out the adrenal formula. I thank you.